Call this February 2nd work session to order. Welcome to those in attendance. We'll start with the invocation. Every favors, you'll give us invocation now.
Father, again, we're grateful for this day. We thank you for your presence. Bless us as we make decisions regarding this work that you've given us. In Jesus' name, amen.
Place the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm going to add Clerk Goodyear to the call. She's going to take minutes from Savannah. You're on speaker, but I'm gonna mute you.
Okay.
All right, the first item tonight on approvals is of tonight's agenda. Is there a motion to approve?
So moved. Second.
Motion made by Commissioner Joplin, second by Commissioner Favors. All in favor?
Aye.
All right, we'll move on to our information and announcements. Number 2 tonight on the agenda is the 2026 ACCG Capital Connection Conference, March 4th and 5th. If you'd like to go to that and have not talked to Clerk Goodyear, go ahead and let her know so she can get you signed up. All right, we don't have any staff reports, but the first appointment tonight for discussion is discussion of Rock House Advisory Commission appointment. Ed Wilson has been on the Rock House Advisory Commission for many years, and he's decided that he's enjoyed his time on there, but it's time to let somebody else get involved. Ronnie Holbrook is also serving on the Wrightsboro Foundation. There are 2 seats on the Rock House Advisory Commission that are excluded to Wrightsboro Foundation members. Ronnie serves on that board also, and they have expressed that they're fine with him taking that spot, so if there's no further discussion, we will add that to Wednesday's agenda. And that is for a term that F is vacating, so it'll be 2025 to 2028.
We extended those, right?
Well, 4-year terms, yeah.
Okay.
But like I said, F's term was 25 to 28, so. All right, we'll add that to Wednesday's agenda. We have no old business tonight, so the first item of new business is item number 4, insurance presentation, and Andy is here with us tonight, so I'll turn it over to you.
All right. So I guess kind of where this conversation started was Brandon reached out about costs, and Chase and I had some conversation leading up to pass those around. Leading up, I got it to so initially it was a cost conversation. And up until Sunday night, that was kind of what I was going to focus the majority of my time on, is specifically the cost. So during some discussions, if y'all maybe share, you and Chase share that and then give them one if you don't mind. So we sat down with Brandon a couple of weeks ago to try to figure out how we could address the cost and be proactive in doing so. And what I just gave y'all there is kind of what we arrived at in that conversation. And the sum and substance was we gave some recommendations of paying 60% of dependents, 50% of dependents, and then if we just use the employee-only contribution and applied that to all tiers of the plan. So if we applied what the employee-only portion of the premium is to all tiers, it would reduce the county's, in the current setup, it would reduce the county's cost by $385,000, I think is what's on there. Now, obviously that cost is getting shifted. That cost is getting shifted to the employees. So you can see on there on the far right of each column, of each box, what it does to those employees' cost per pay period. So, for example, and I'm gonna look over your shoulder if that's all right with you. For example,
Here's another copy.
if you're looking at the employee's spouse, right now they're contributing $236 per pay period. That would go up to $452 per pay period. So that's kind of where this conversation has started, and we're trying to get the plan aligned with somewhat of the market because it is rich. But so there's two ways to attack cost. One is in contributions, and the other is through the plan design and the performance of the plan. So this is kind of where we started a couple weeks ago. I've got a full report of where we sit year to date with how the plan's performed. To last year, the plan performed terribly. We received a almost 33% increase. We went out to the marketed it with everybody. ACCG, Blue Cross Blue Shield Regular, United Healthcare, you name it, you name the carrier, they saw it last year. We landed on this Crumdale option, which was a reduction of about $301,000 from the offer from the renewal with Meritain. So while yes, we got a huge increase, I mean, it's tough to absorb. It's tough to absorb a 21% increase. Totally understand and agree with. We went to everybody that would look at it, and that was the best result we got. So I say all that to say I've got a little. I'll pass this out on that, or y'all got this right here, right? Here, actually, I summarized this big old packet with this, if that's okay. And then that's the supporting documentation behind it. Yeah, pass that around. So, last year renewal 7-1, we moved it to Crumdale. That Crumdale option, and y'all, I'm gonna try to simplify this so it doesn't get too confusing. But the difference between a Crumdale setup and a Blue Cross Blue Shield. If you go direct to Blue Cross Blue Shield, 60% of y'all's spend is in pharmacy. So 60% of y'all's cost historically has been in the cost just for prescription drugs. They're gonna, and say that claim spends $1.5 million, which is not, that's about what it is, $1.5 million. Blue Cross Blue Shield is getting rebates on all those drugs and baking it into your loss, your claims expense. And that's typically about 30% of the claims expense. So what we have done by unwinding it and getting your own pharmacy benefit manager, that rebate comes back to the county, not to the carrier. Does that make sense? So unwinding this thing from a Blue Cross Blue Shield, the whole strategy there is for y'all to be nimble in what y'all can offer and participate on the rebates and identify specific situations that are going to cost the county moving forward and address them as proactively as we can. It's good data doing it this way so y'all can react appropriately. So that's where we were then. Through 6 months, the plan's performing pretty well. There's a real detailed summary of month to month how much the claim spend has been by each category: pharmacy, medical, etc. But I didn't, if we were to go through that full presentation, I would probably take up a lot more of y'all's time tonight than y'all wanted me to. This 2-pager right here is gonna summarize that for everyone. If y'all wanna dig deeper, we can dig deeper. Right now, claims are running at 76.2% of expected. So you're paying what your max exposure right now. So your claim spend is at max, meaning if there's money left over, it's coming back to the county. All right. And right now we're running at 76.2% of that of expected. We have 4 high cost claimants that represent 32% of total claim spend. We have projected out, this is some projections based on, we think some of the higher cost claims are one and dones. Of those 4, we think 3 of them are one and dones. So we're anticipating that the projected loss ratio for the year will be right around 70%, which is good, which is real good. So that could, if we do operate at a 70% loss ratio, there will be surplus remaining in the claims fund that comes back to the county. Now that period is about a 6-month run out. Why has the plan performed better than last year? In this setup, we've taken advantage of prescription drug rebates of $76,210. That's estimated, and that's through 6 months. So if you annualize that, that's $150,000 in rebates that you're getting back from pharmacy being set up this way. 2 high-cost drug patients have answered the call and gone through the process of getting a patient assistance program. So the patient assistance program, it's something that is available through this setup, through Blue Cross Blue Shield. It's not available, but in summarize what a PAP is, and that's what we call them, PAPs, is if someone's taking a medication, they'll be contacted by the PBM. And they specifically contact those that are eligible for PAPs. So that PBM will contact them, say, hey, we understand you're on so-and-so Tremfya medication, and we want to see if you're eligible for a PAP. It helps you, it helps the plan. And y'all understand when I say the plan, I'm talking about the cost for the county. So that's when I refer to the plan, that's the cost to the county. So that person gets contacted, they go through the process, say they qualify to get the Tremfya for free, because these drug manufacturers, they have grant programs out there for certain individuals if they qualify. And in this scenario, we've had 2 that have qualified, resulting in $165,000 in savings to the plan. And it also saves them because they don't have to pay the co-pays for it. See what I'm saying? There are a couple of those out there that we haven't had some success with, but that's down to 2. I think when we met with Brandon last time, there was 5. That's down to 2. So getting some traction on that. Total, there were 7 that were eligible on the plan. Out of network claim negotiations, there are going to be situations where folks have to go out of network to get something done because they just have to. That's resulted in $10,000 in savings. And then the telemedicine, there's only been 7 folks utilize that, but that saved $864. So total savings through programs we've kind of put together to help y'all control cost are $114,000 through 6 months. So why is the plan performing a little bit better? I think a lot of it has to do with these programs that are in place. There are 2 more PAP eligible employees that we'll continue to try to work with and talk to see if they qualify. The dependent cost impact. So the dependents make up 41% of total claim spend. So as y'all are making the decision, hey, how do we want to treat the dependents? How much y'all will pay for the dependents insurance? Understand that 41% of claim spend is coming from dependents.
What percentage of drug costs would that be? Because you said 60%.
Y'all are running at 50% now because of some of these reductions here. I'll tell you. I can't tell you the dependent specifically. It's not broken out
I'm
to
just
that.
throwing that out to you because, you know, if drug costs are 60% of our total cost.
They're not even through these programs. They're not. They're through since the programs. They're a little less than 50% now. But
Drug costs.
yeah.
Yeah.
So
So the pharmaceutical,
Where you finish?
Yeah, I'm done.
so the pharmaceutical managers basically help them see if they qualify for a savings so that it could be at least zero. So what about if they have a name drug but generics out there are the same? That's something that take place we could.
yeah, there's always encouragement to go to a generic brand, and y'all are at 83% utilization of generic brands. The kind of which is close. The target is 86 to 87%, and y'all's folks 84% of all drugs. Let me make sure I'm quoting that exactly correctly. But so the majority of the population is using generic drugs, which is good. Now, the one thing I see Brandon printed out that there was a survey done that he sent us Sunday, and I didn't realize it was going on. I would have been happy to participate in it and help, but it's 84.6%, and your target range is 87.5%. So to kind of jump a little bit to that survey, you know, some of that, because I think it's relative to the pharmacy conversation, some of that survey is up until last year, there was 12-month period of time where everybody's getting Mounjaro for zero cost, because CVS was a PBM through Meritain. They were running a program to do $0 Mounjaro. Well, under this plan, it goes in as a brand drug, so they're having to pay a copay for it. But that drug is $1,200 or $1,000 now. It keeps going down, but it's like $1,000 a month that it cost, and they're paying $40 for it. A year ago, they were paying $0. But so a lot of the feedback when it talks about the copays and the drug cost, a lot of the conversations I think are around that specific item. And to put that into context, the GLP-1 drugs, that's $145,000 of y'all's claim spend is GLP-1 drugs. So that's a big driver. Last year was much higher. So it's a cost that has been hard to manage from y'all's situation, just because the diabetic percentage of the population is high. That makes sense. I was a little long-winded answer to your question, but dependent cost. I think that's kind of where I guess from our standpoint, we would like to have a good feeling from what y'all want to do to dependence costs going forward. Because if we do make, and this was a conversation we had last year leading up to the renewal, if we do want to make a change which could significantly impact the employees, we want to make sure we're giving them plenty of time to go find additional options out there. One negative thing that's happened is the ACA, some of the subsidies, I guess they were supposed to come back in. I should know that, I don't, but them pulling those subsidies away really hurt individuals getting individual health care. But some type of encouragement to search elsewhere to find coverage for spouses is, we want to give them time to do that if that's what they need to do.
Have we talked any about we come up with a solution if we stay with Cromdale about the fact that so many people aren't in network?
So the the out of network claim spend. So the network is the same as several of the large employers around here. It's the exact same network. So I'm happy to run like a network disruption report, just so you can see the difference between that network and like a Blue Cross.
That was the only complaint I've had over the past year, was that folks have tried to use their doctors here locally, and the doctors were out of network with the claim.
And I think some folks used, whenever they gave them the Health Easy, because you know, we were talking about it earlier, gave the Health Easy, they're like, Health Easy is not in our network. Then they called the number and it was approved.
Okay.
So I think some of that is
Provider education.
Yeah, the provider just is assuming, maybe it's somebody new at the front desk and they're assuming that they're not. I mean, that's something that the advocacy folks can handle. I mean, you can call claims advocacy while you're standing there and it gets resolved. And that was one of the, so we took that survey that y'all did, and look, we want to address those issues. So we put together a response action plan and prioritized it based on the responses within that. And some of it is as simple as a one-page education piece, one-page education.
Now, if they ask the provider to call that number, is that the same as you calling that number?
Yeah.
Or me calling that number? Say I go in and have my card and she says I'm out of network, and then I say, well, call the number on there and verify that. Or should I say, well, since you said that, let me call and let them talk to you or something? I mean,
Yeah, so that number on the card, the advocacy number, if the provider calls it while they're standing there, it gets resolved right there. Now we've called multiple times to get it. We've called, if we find out that Center for Primary Care is saying they're not in network, we've called Center for Primary Care and say, hey, y'all are in network. This is, and then they say, oh, okay, I got it. So I mean, it's resolvable.
That's just tell the patient that, I guess, get that across to the insurance recipient or the insurance, the patient who has the insurance, have them call them.
So so there's $21,000. Actually, the plan paid $11,000 in out-of-network expenses. So $11,000 claim spend has been out-of-network. Total that has been in network is $553,000. So 11,000 out of 553,000 has been out of network.
Yeah.
So that's a 99% in network.
All right. So this report shows kind of what the cost would be to push back on the employees. Does it show are we looking at a significant increase this year?
If the plan performs like it is, I think we'll be in decent shape, but you never know what's going to happen. I mean, the thing is, it's premium paid in versus claims paid out, and there's no way around it. So as long as it performs well, I think we'll still be in good shape, Chase. And there could be some surplus.
Can we, kick the can down the road 3 months and get a little bit better feel for it?
Yeah, I think the reason we're talking so early is just to get the whole board aware of kind of, if we were to push to an employee, or a dependent, where the employee pays for the dependents, we want to give plenty of notice to the employees. We don't have to make a decision tonight, but, last year when we talked about it, it was kind of far along in the year, and we just absorbed the cost so that the employees
Right.
didn't have to go find coverage for their spouses or children elsewhere at the last minute. And I think Andy was trying to explain kind of our options here.
And I mean, there are folks that do sparsely. If the spouse has credible coverage somewhere else, they do a spousal carve out where they have to go to their employer and get it. A lot of times, y'all, the spouses do have access to health care with their employer, and they just don't take advantage of it. It's more times than not, if the premium cost is typically a good bit less if they go to their employer, because the employer has to pay 50% of the premium.
Thank you, Andy. And
Well, do we have the ability to have them do that, to carve it out? Or do you have to?
Yeah, they have to sign an affidavit. They just sign an affidavit if they don't have access. I don't know. I mean, that's being pretty aggressive with the situation.
Well, it looks like to me we're basically the same as last year, all things considered.
If the plan continues to perform well, y'all will be able to get a chunk of the additional cost back. But the plan has to perform well for that to be the case.
With the projection say, but like I say, you never know what's gonna happen.
That's why I'm careful.
Somebody
with
goes
what
out
I'm
there and hit by a church fan.
Do y'all want to talk about the survey at all?
were you gonna,
No, I was just gonna give that to y'all, just so you can see what some of the employees were saying. I've got it printed out here. I wasn't gonna go through it line by line. But I just wanted y'all to see what some of the employees were saying. We've only had it out for about a week. We've got, I think I've checked, 28 respondents. So we'll keep it out a little bit longer. But I was just gonna give that to you so you could see what some of them were saying.
Where is it?
I haven't given it
Oh.
out yet.
No one could.
Yeah, I was just gonna hand it out and let y'all read it. Just skimming through it, and I haven't processed these. A lot of them are, I guess, things that we could do in conjunction with a insurance planner over there is Q&A sessions, one-page guidance things, and more information on this prescription or the provider assistance program. A lot of people are unfamiliar with that, and I think some unclarity on how the copay worked versus with respect to name brand versus generic drugs.
Seems like I talked to Ruthie about that, and a Q&A thing probably wouldn't be a bad idea, for the department heads to go.
I think so. As we get closer to this, and like the chairman said, we don't have to, and I'm not wanting you to make a decision tonight, but I want you to be thinking about it, asking questions, so we don't get at a pinch point. But those are some of the things that we need to have with staff, a Q&A session, so they can come in and explain the different facets of the program, that there's a prescription drug program that's available, and help us develop that one pager for reference and an explanation on the copay. I think just what I quickly gleaned from this, that's where a lot of the concern and confusion lies.
And I would agree with that. And we set up open enrollments 2 different ways with the county. We meet with each individual, every single employee, and we sit down with them. The other way of doing it is having a group meeting and then have them go through it after that group meeting, which sounds like we should probably adjust to that next year so that we can address some of these things in a group setting and then have them go through individually. But just different ways to do it. We probably need to adjust how we're doing it just so that we can address those things.
And Andy had already touched on it. I believe the Health EZ, a lot of these things I see on here is people are unfamiliar with it. And there may need to be some information that, be sure to call this number. If for lack of a better word, the front desk, gives you any hassle, that they need to call and, like he said, and I've had another staff person confirm that usually it's resolved within, 5 minutes or so by making a phone call. They're not familiar with seeing the Health EZ, and I think that kind of throws some people off. And again, the in-network thing was another, I guess, concern, question.
The ID cards, so dental and vision, that was mentioned a decent amount in there too. The dental and vision, there are no ID cards anymore. You just give your social security number and that's what gets you care. Your name and your social. So that was a little confusing for people not having dental and vision, but that would, a Q&A open enrollment would help with that. We did have one situation where the person was in network, but when they went, it must have been under contract negotiation because it was showing in network on the internet, but they were having contract negotiations while they were trying to get the care.
Yeah, that was me. So, there's some, we just need to work with the Health EZ and maybe some education on our part that we can push out to staff. So.
Well, it's such a complex issue, for the ordinary person, you're looking at all these different things going on, and I had a problem with it myself, but it was quickly resolved, but you're looking at a bill or something like this, and it comes in, it's like, well, why is this, or something like this, and phone call might resolve it.
I mean, hey, look, like, we would love just to be Blue Cross Blue Shield. Simple. For us, this is the hardest way for us to do it. But it's the best thing for y'all. So.
I did have a conversation with the ACCG, and we were looking probably at a 30% increase. And they would not commit to that because they didn't know, lack of a better word, and just for brevity, that if that was the sustainable price point for them, so it could go up.
They quoted it last year and they were 58% over the renewal.
Yeah. They were looking at 30, to begin speaking, was 30-something% above the renewal.
Was that their Blue Cross? Is that what they were?
They used to be Blue Cross.
Used to be.
Blue Cross.
It was the same thing that we had.
It was Maritime. So it was Blue Cross Blue Shield. Mid-year, Blue Cross Blue Shield pulled their contract. UHC came in and helped them get through that plan year, I think from 10-1 to 7-1. That was 2 years ago. And then they did the exact same setup we had JAWS set up on up until last year.
ACCG?
ACCG, they modeled the Maritime situation that y'all had up until 1-1. And not to try to get into the weeds too much, but what happens, CVS Caremark, Aetna bought, or Maritime bought CVS Caremark. So then that took away all the benefits from the rebates on the pharmacy drugs. And we were trying to get them to let us use a different PBM so y'all could still get the rebates, and we couldn't. We had to use that one specific PBM.
With Maritime.
Correct. And then y'all should have the ability and the right to pick y'all's PBM instead of them dictate what PBM y'all gotta have. So some of the benefit went away because of that acquisition. Makes sense?
it makes sense, but, and you can't help that, you know? There's nothing you can do about that.
But I do, you know, something for y'all to think of, you know, I certainly don't, you know, trying to be a good fiscal agent for the county, you know, and also offer a premium benefit to the employee, you know, because that's part of our recruitment and retention package, as well as providing health care for spouses and family and children. So, it's doable. We could save some money by tightening up on that. But as you see in that column, what the employee has to pay per pay period is pretty steep. So we might could incrementally, we might could back off of that and work it in phases over a couple of years.
Yeah, I'm not so in favor of doing our employees in so quick.
Exactly. I mean, it's a pretty drastic change from going to paying
That's a lot.
$343 for your, if I'm on the right line here, family up to $775.
And so what we talked about is we can start by taking some of these preventative measures and doing some of these lunch and learn type things. And
I think our educational component is gonna be part of it, and that's what I'm seeing from some of the responses that are coming in is we do have benefits, but we're unaware of them and how to properly utilize them.
do y'all have any other questions for Andy tonight? If not, I say we just think on this for a while. We can bring it back to a work session in March if we wanna have some further discussion.
So next one is.
Okay. Now, ACCG had problems with Blue Cross Blue Shield, and there were some things that were just not working with that, so I had to leave Blue Cross Blue Shield and try to make it through and really trying to pull together a pool, like workman comp and property pool from ACCG standpoint. But it's all too slow to start. Health insurance is a monster.
It's a monster, and it's a big ticket item for y'all. We want to do everything we can to help y'all manage it the best you can, and find that happy medium with coverage and cost. We all want best coverage at the cheapest price, but sometimes you got to find that happy medium.
All right, well, thank you for being here, Andy.
Thank y'all.
We're increasing the 2,000 help.
It helps a little bit. It moves the needle a little bit, but you got to think the majority of the costs. What I say, 32% of your claims are from 40 individuals. So not many people are hitting that deductible. That's my point. So if you move it up $1,000 and call it 20% of your population hits it, you know, you're only talking about moving $15,000. So I would.
It's not worth the penalty for
Yeah,
the rest
I mean,
of the
you want to protect the person from having to come out of pocket a lot, and you want to spread that risk amongst everybody the best you can. So that's my opinion. All right,
Thank you.
thank you.
All right, item number 5 is discussion on moving March 4th meeting due to an ACCG Capital Conference. I think several of us will be out of town for that conference with ACCG. We'll have the work session Monday, March 2nd. And I think Brandon's recommendation was just to cancel the meeting unless anybody had any. We have enough time now, we could advertise and reschedule the meeting for the week after the 4th through 6th.
Yeah, that's what we've done in the past, basically.
I mean, we could go ahead and advertise that, if, set a meeting date, that way in case we do have some business to take care of. Is that what you said y'all done in the past?
Council, if we needed a meeting, we would call one, basically. Well, basically, we just want to cancel it.
I think that,
Interfere with, when we had something like this, and then if there was something that was an absolute need, we're going to call one.
yeah, we'll have our Tuesday night meeting 2 weeks later, so. Does anybody got any problem with that? If not, we'll just put something out tomorrow that, we're gonna cancel the meeting for,
Well, basically, all you're doing is, doing the work on Monday night, and then whatever's on that agenda,
push it to Tuesday night.
yeah, push it out Tuesday night.
Yep.
For approval or whatever,
That's right.
and we can minimize that if we need to.
All right, but item number six is discussion on solid waste RFP. We'll turn it over to Brandon.
If y'all remember, we flew a RFP to, try to get better pricing, and different vendors. Make this competitive, for our solid waste. We got we got 3 bids. One was late, so they were not considered. We got 2 bids, one from Waste Management and the other from Republic Services of Georgia. 3 people ranked these. We came up with a mean score, and Republic Services of Georgia had the better score. I did call another county that is under contract with them. They're very happy with Republic. They haven't had any issues. Their costs have been stable. The only cost that they have had increase on has been just basically your inflation, your CPI. This one did not indicate there would be any escalators in the proposal. That they would, in fact, be the same for the CPI, and Waste Management proposed $63.83 per ton, and Republic proposed $57.50 per ton, and Republic did not have a surcharge on minimum like we're paying now. I think it was estimated we'd give them what we normally do, about 20 tons a load.
Have you got something that might be interesting to look at is, I've seen Republic cans all over the place. Maybe, would it be advantageous to propose to the city that they ask Republic, maybe we get a package deal for the city and the county, because Waste Management's doing the city now. If we change to Republic, then Republic might be able to sweeten the deal by saying, hey, look, we're getting the pickup in the city plus, and then maybe we can ask for, like I say, get it sweetened a little bit.
Yeah, I can definitely have that conversation with you.
Cause that was one of the deals that we, Waste Management came in fairly low, as they thought they were gonna get the county-wide trash pickup, and that didn't fly. So, it may be something to look at.
All right, well,
That go on the agenda?
I was supposed
We're
to
gonna approve
say,
that?
yes, you have any other,
We can push this one out farther. That'll give me time to talk to the city and talk to Republic. So we won't have this on Wednesdays.
push it to Tuesday night?
Yeah.
All right. You hear that, Clerk Goodyear?
Yes.
All right, and item number 7, discussion on roof replacement for RFP.
All right, I had an invitation to bid for roof replacements. This was for the Public Works building. That roof is leaking in bad shape, and also for the one day soon to be elections building behind the gym in town. I put these out. There's a bid tabulation. If you'll look at the spreadsheet chart, it lists all how they bid per unit.
So CRT is not considered at this time.
They were rejected due to an incomplete bid.
So the low bid is,
Traxel Contracting.
is there any reason to hold this one up, or can we just push this to Wednesday morning?
I've not found any reason to hold that one up.
Is there any discussion on that item?
You can't do it with
Diligence with
CRT.
them. Do not get due diligence with them, they're good.
Yes, sir.
there's no further discussion, I say we move that to Wednesday morning. Item number 8 is discussion on setting public hearing dates for proposed data center. And I'll give the floor to Mr. Burton.
Yeah, there's nothing to hand out on this one. I just wanted to get y'all's opinion and go ahead and set this public hearing date for the data center. It will be on the March 3rd Planning Commission agenda for public hearing. And then our next meeting would be March the 17th. So if that date, and the reason I'm doing it this way, so we can get plenty of notice out, more than 15 days. We can have at least a month worth notice, so folks know that this is when we're planning to have the public hearing. You don't have to have it that night, you can push it out, but it's whatever y'all are comfortable with.
That's when?
March the 17th.
St. Patty's Day?
I guess so, I didn't,
Yeah, that's our Tuesday night meeting.
yeah, that's the Tuesday night meeting.
Well, I'll
We
go
have
ahead.
to postpone the meeting, we gotta go to the St. Patty's Day parade.
Yeah. I'll move on to item number 9 too, then in talking about the public hearing dates. Item number 9 is discussion on having a data center listening session. I think you've got some recommendations for us there.
Well, I know the developer has reached out, and I just want to see if y'all are interested in hearing them speak, or anybody else of that matter, speak on the subject. This wouldn't be the official public hearing, that would be reserved for that day in March. But do you want them to do a presentation or just take the information from the planning that they give at the public hearing for the planning commission and the one at the board of commissioners hearing?
I'd like to hear what they had to say. Because there's so much false information out there that, you know.
Just looking at
And kind of going back to number 8, I did talk to the regional commission, because I wanted to make sure they had plenty of time to do they're in the process of doing their comment period, their 15-day comment period for other government agencies and jurisdictions. She said, she had indicated that they would have everything together by that time, so y'all could review the regional commission's comments as well. And then you'll also have the emails that we've received for public commenters record as well.
I Googled that today about negative effects on the environment for data centers. And basically most of those are macro rather than micro. So it's kind of like the whole world, you know, it uses more electricity and water and this kind of thing. But locally, it really has no impact on a local level that I could glean. I'm going to look at it at other stuff, but the Q&A that I saw basically as macro issues as opposed to local issues.
I think everybody's got a lot of questions about them, so I wouldn't mind seeing them.
Okay.
That's kind of my
Can we
point.
have that though before the planning board meets? Because I guess we need to run that by Dave Dunaway. I don't know that you can have that before your public hearing.
I would think not. It probably need to be somewhere in between after the planning commission and before the board of commissioner hears it.
So I don't think anybody's opposed to having a listening session for the community to come to.
Okay.
Just might want to check on that, on the date.
The IDA bringing Georgia Power representatives in on February 19th to give pros and cons of a data center. Open that up to anyone who wants to come to it. So Georgia Power was, it's not a true or for or against, it's just an open understanding of what data centers, pros and cons on both sides. So they got it February 19th at 10:30 at the chamber. I think it's at the chamber.
Thank you for letting us know
Maybe
about
let
that.
Ashton know so she can, disseminate that information.
Who's that? Action?
Do what?
Did you say let her know?
Let her know so that she could disseminate that information to us, and the other board members.
We'll get it to her. Alright, we'll move on to item number 10, discussion regarding Ferris Road request from Georgia Ironworks. Back last fall, I received a letter from John Thomas and Thomas Mueller with GIW. Basically, as you know, Ferris Road bisects the GIW plant here locally. They've got some plans for expansion, and they've seen a heightened amount of traffic over the years through there. Puts their employees at risk and the citizens that are driving through there with forklifts that are crossing the road. Also, the road's in pretty bad shape and needs some improvements itself. So they've come to us saying that, and I guess they had reached out to the county in the past, from what I understand, but they either need some improvements on the road, or the road, they'd like to see the road clear, the road deeded to them, and they can put a gate up on both ends to keep traffic from cutting through and causing safety issues. So here's the letter. We got it in the packet for you. Tonight's just to kind of discuss the feelings of the board on
You
that.
remember we,
We've done this for
talked about rerouting around the outside of the property?
Yeah, that was the last thing that they were.
Yeah, and,
that thing that they've done, it was supposed to have been sort of rerouting it.
Yeah.
That's what they.
because we were asking about that because, you didn't want that road closed.
Yeah. So, that's right, they were supposed to look at rerouting it, and I think Gloria made mention that they had probably could get some IDA funds to look at doing that, and that's what we left it from last time.
Yeah,
So we usually don't allow public input, but I know, since they have a representative there he can correct me if I'm wrong, but the last time we talked, they had basically agreed that they would put in the cul-de-sac if we were willing to close the road, through their property. So the county wouldn't be on the hook for that. Is that still the case?
correct.
Okay. So.
I know I'm not for closing that road, but we did offer a solution the last time to go back and take a look at,
What was the solution?
Well, it was rerouting.
Just right around there. I think it was on the south side of the property. It'd go around the south side and come in, is that the side the car dealership is?
Just bring the road around and tie back into Ferris?
Yeah.
Okay.
Yeah.
So, that would require making the road a whole lot longer. What was the purpose of rerouting it south of the property instead of just
Just not
Coming
close the
out.
road.
Yeah, we're not closing, county road, response time, other things, holding us off in that area back there,
Okay. Alright, well, we'll have another, I guess, Brandon, we can get with GIW and have some further discussion. On that. Alright, item number 11, discussion regarding SPLOST 8 intergovernmental agreement. I think, we had a joint meeting last Thursday We have the draft IGA in the packet. And you haven't made many, edits on the list yet, have you?
No, sir, I have not had a chance to edit this. I just wanted to see if y'all had any epiphany since the last meeting.
Is there
And
any change in this?
I have not changed it, no.
No.
I was just, more or less tonight I've not changed the document there, but wanted to make sure if y'all had anything you wanted to add to this, if y'all had any guidance on what to add, take away, on here.
Well, I think the devil's in the details on the negotiation, who does what, and the agreement has been good for
Was there any,
20 years.
was there any comments on this list from anybody? I guess priorities even?
I think I was still looking at it, but I did come across a couple of things, and a couple of things I think if the state holds true to what they're going to do, might remove some stuff for us, because when the state, planned to do a statewide revamping of, 911, their role and stuff, that might eliminate some things for us. They're moving forward as aggressive as they say they are, so a few other things.
Yeah, we may know some of that, after they set their budget this session, so. The E911 updates, as you said. I think there's some places on parks we can maybe put some match funds and try to bring that number down. Alright, well, if there are no further comments on this list, did you say we have executive session personnel? We have an executive session on personnel? Or
Did
you wanna
y'all,
wait till Wednesday?
y'all amend the agenda?
We did not.
Yeah,
We can add
we'll wait.
to Wednesday.
Yeah, since y'all already approved the agenda, we'll wait.
Alright. There's no further business. Is there a motion to adjourn?
So moved.
Commissioner Johnson? Commissioner Bailey?
So this will be on the